We're going to discuss the concept of ethics as it applies to physicians versus nurses versus technicians, and whether or not there's a stronger or weaker set of ethics for each of these groups we just discussed. My take on this is I feel that there is a stronger connection or set of ethics for physicians, since technically they hold the power. They've got the knowledge, they get to make the decisions, and without their approval, they're basically the medicine and the treatment can't happen. Ignorance is something that they're constantly having to deal with the patients, and patients being uninformed about why the medical treatment is necessary, as opposed to, just not giving them the medication or, recommending the surgery that they need, and without the physician recommendation, the patient wouldn't know. So the physicians really have the strongest code of ethic, to where they need to make sure that they're sharing their knowledge and that they're practicing medicine for the same way across the board. The nurses also have a strict code of ethics that they need to adhere to, but they've got a little less power than the physicians. They're really watched, and they're still under the physicians' guidelines, so they have certain rules that they have to adhere to. They don't get to make the same decisions that physicians do, so their code of ethics is a little bit different. Again, they hold more knowledge than, the average patient when it comes to their health care, so it's important for them to share that with the patient and to make sure that the patient understands why different treatments and why things are necessary, to try and get the most compliance possible out of these patients. It's also important that the nurses stay within their scope of practice, and they don't perform anything that is outside of their scope or without actual physician orders, or to give any advice that, again, is outside of their scope that goes against what the physician may have ordered. As far as techs, they still have a code of ethics to adhere to, but seeing as they have limited contact with the patient, they aren't making the medical decisions. They're either just performing the tests that have been ordered by the physicians, or, that the nurses have recommended. As long as they are performing the tests appropriately and that each patient is getting, adequate care, then the techs do still have to adhere to a code of ethics, but it's a little less than what the physicians and nurses are expected to do, since, they've got limited things that they need to do with the patients. They need to just make sure they're entering the information properly. They need to make sure that, they're viewing things properly. If they see something, like, say, the tech is doing an ultrasound and she sees something that she thinks is out of the ordinary, it's important that they do make sure that they get a good picture and not just kind of skim over it, because it might cause them extra work. But as far as, anything beyond that, they don't have a whole lot of liability as far as that goes. Thank you.